I stand before you today with both a heavy heart and a hopeful spirit. The story of Marshmallow's hope began with tragedy, the loss of a young boy named Zachary Burkholz, who at only 14 years old ended his life by suicide. Zachary was full of promise, yet overwhelmed by struggles with mental and emotional illness. His passing left an unfillable void in the lives of those who loved him, and it illuminated a heartbreaking truth. Our community lacked the resources needed to support young people facing such battles. Zachary's story is why Marshmallow's hope exists. Out of profound loss grew a determination to ensure that no other family would have to experience the same devastation without access to hope, healing, and help. That determination came from Laura Kane, Zachary's mother, who founded Marshmallow's Hope in her son's memory, transforming grief into purpose and building a program that has since become a lifeline for countless families. At Marshmallow's Hope, we started by offering free traditional one-on-one counseling, giving individuals a safe space to share their struggles and find professional support. But as we listened and walked alongside families, we quickly realized something critical. Sometimes therapy alone isn't enough. Youth experiencing suicidal ideation and significant mental health challenges often need more than a few hours a week to heal. They need a higher level of care, one that is structured, intensive, and tailored to their needs. That's when, with the visionary support of the Winnebago County Community Mental Health Board and the funding made possible by the 1/2 cent sales tax, we created something our community had never had before, an intensive outpatient program, IOP, specifically designed for youth whose primary struggles are mental health conditions. Our IOP is a bridge of hope, a comprehensive, evidence-based treatment program that combines proven therapeutic approaches with mindfulness practices. Participants attend structured group therapy, receive peer support, and build real, practical coping skills that empower them to manage their mental health. Unlike inpatient hospitalization, our IOP allows kids to maintain connection with their families in daily lives, but it provides significantly more care than weekly counseling. We run 5 days a week, offering up to 20 hours of care, and because we understand the importance of education, we operate during after-school hours, ensuring that participants can still prioritize their school responsibilities while committing fully to an 8-week program of healing and growth. We have seen the transformation firsthand. Teenagers who once felt isolated and hopeless are rediscovering their sense of purpose. They are learning to navigate the stresses of adolescence, gaining tools to cope with anxiety, depression, and trauma, and building a supportive community around them. Parents are regaining stability, families are experiencing healing, and hope is being restored. But this impact is bigger than any one individual. Every young person who finds healing strengthens the fabric of our community. With fewer hospitalizations, reduced strain on emergency services, and greater resilience in families, Winnebago County is becoming healthier and stronger. None of this would be possible without the Winnebago County Community Mental Health Board and the foresight of local voters who approved the 1/2 cent sales tax dedicated to mental health. This investment ensures that life-saving programs like ours exist, not just in name, but in practice, ready to meet youth and families where they are, without financial barriers. At Marshmallow's Hope, our belief is simple. Every life has value. Every child deserves the chance to heal. Zachary's story will always remind us of why we must continue this work, and thanks to the vision of his mother, Laura Kane, and the support of our community, we can. If you or someone you know is struggling, please reach out. Hope is here. Help is available. Together, we are building a stronger, more compassionate, and resilient Winnebago County.